I've said for a long time that the most important resource in this business is a colleague. Okay? The ability to talk through something with somebody else, the ability to say, has anybody else seen a patient with something? The centers improve the ability to do that. We have a dermatologist who has a collaboration with another dermatologist who's in Pittsburgh. And between the two of them, they have established a robust patient registry and contact process within the patient community, which has benefited everybody, right? And they study a rare disease called morphia. That's the big goal. You know, the world isn't as small as it used to be. And we can take advantage of that in being able to put people with the same information in the same room, or at least in the same Zoom meeting, to be able to further care of the patients. One of the things about rare disease is that it can be taken care of in multiple different places, but not always in the same way. Unlike things like Down syndrome or high blood pressure, where there's an overarching agreement about how it's cared for. That's not true for a condition for which there may be 1,000 people in the country. And one of the stated goals of NORD with the centers is to help establish standards of care for those patients with those diseases, where they may very well be the only one in their center, even a center as big as UT Southwestern, with that condition, so that the patient in Dallas is getting the same management as the patient in Pittsburgh or the patient in Seattle or the patient wherever. That extends even to smaller towns, you know, to people who aren't near a big medical center or can't travel to be seen on a regular basis. There will be a system of information that can then be fed to their local physicians who will be able to help manage the patients locally. There's a lot of nuance that needs to happen, or maybe bureaucracy. There's a lot of bureaucracy that needs to happen. During COVID, the rules about telemedicine across state lines became much easier. Those have since firmed up again. One of the subcommittees that NORD has put together has the goal of addressing the ability to do telemedicine and make access to experts easier for people who don't happen to live in the same state in which the physician is licensed. Things such as that. So it's not as simple as it sounds like it should be, where a person in Peoria could see a doctor in New York City without having to go there. Our technology is there. We just need everything else to work.